Well, good afternoon, everybody, and thank you for joining today's briefing. Before we discuss COVID, I want to update you on the impacts of Tropical Storm Fred in western North Carolina. I've declared a state of emergency for this storm and spoken to numerous local officials to offer assistance. Our emergency management team is working closely with local emergency management in western North Carolina on search and rescue. Approximately 250 public safety personnel are conducting rescue operations by boat and aircraft. Haywood and Transylvania counties were especially hit hard, seeing as much as 12 inches of rain over the last couple of days. Initial unconfirmed reports in certain communities show water levels reaching 3 to 7 feet higher than their previous high water mark. Overnight, approximately 98 people were rescued as river flooding happened quickly, and reports of missing people continued overnight and today. Up to 50,000 people lost power during the storms, and now that number has been reduced to 11,600 people who are still without power. Crews are working to assess damage and get people reconnected. All major interstates are open right now. We do have 6 main road closures and 49 secondary road closures that the North Carolina Department of Transportation is working to assess and reopen as soon as we can. With more rain in the forecast for the end of the week, we know that more flooding is possible. North Carolina is all too familiar with devastating flood events, and we'll continue to monitor and provide support from the state level. Our prayers are with families and businesses that have been affected, and we want to thank everybody involved in rescue efforts and power and road restoration work. I and North Carolina Emergency Management Director Will Ray, along with Transportation Secretary Eric Boyette, will take questions on this at the end of the presentation. But now I want to talk about COVID-19. As of today, we have had 1,131,243 cases. 5,256 new cases reported since yesterday. 2,930 people in the hospital, that number is rising. And sadly, 13,952 people who've died. Today we'll share updates and our state's metrics. But first, I want to announce the final winners of the North Carolina's Your Shot at a Million and Cash for College scholarship drawings. The final winner of our $1 million cash drawing is Lily Fowler, who's from East Bend in Yadkin County. She's in her senior year at North Carolina State University. And Lily, I'd like to ask you to come up and join us. And she's told us she's willing to answer a couple of questions for us. So, Lily, hi. Why did you choose to get vaccinated? And what would you say to people on the fence who are thinking about getting vaccinated?
Well, I chose to get vaccinated because I was transferring from an early college, and last year, junior year of college, I wasn't able to live in Raleigh, but now I'm in my senior year at State. I'm in Raleigh. It's a bigger city, more risks, and I decided it was probably time for me to get vaccinated. And what I would say to somebody who is on the fence about getting vaccinated is to it's a personal choice, you know, just do your research with sources you deem reliable, and that's probably all I'd say.
So Lily, anything you want to share with us about what you might want to do with your prize money?
I'm pretty frugal. I think I'll probably just maybe invest and wait till I'm going to buy a house. However, in the short term, I do want to take my baby cousin Kinsley, who loves Elsa and Mickey, to Disney World when it is safer to do so.
Thanks a lot, Lily. That's a great story about why you chose to get vaccinated, and thanks for sharing with us. We also have our final scholarship winner with us. 15-year-old Breland Dean lives in Garner and is a rising high school sophomore. Breland's a student athlete whose parents will quickly tell you about her 4.0 grade point average. She's here and she's also agreed to answer a couple of questions for us. So thanks, Breland, for coming up. Breland, if you could tell us why you chose to get vaccinated and what you'd say to people who are still deciding whether they should get a shot.
I chose to get vaccinated because it will protect me, my family, and the others around me to prevent any other spread of the virus. To the people who haven't gotten vaccinated yet and are unsure, I would say that you should maybe take into consideration of how this virus has affected the world. And if you would like to protect the ones you love, please get this virus.
Breland, that's a great message. Anything you might want to share with us about what you'd like to study in school with this college scholarship?
I have not put into any thought of what I would like to study. However, I am leaning towards UNC Chapel Hill to continue my studies.
That's great. Thanks, Breland. We're so happy for you and happy that you and your family chose to get vaccinated and that you'll get this significant scholarship opportunity because of it. Thank you. Our cash drawings have ended, but there's good news. You can still get your vaccine and be protected against this deadly virus. And in many places, you can get a $100 cash card just for getting your shot. And with our COVID-19 numbers getting higher, vaccinations are the best way to bring them down. The vaccines are safe, effective, and free. With the vaccine, you protect yourself from the risk of hospitalization or death. Without it, you're vulnerable. And the statistics bear that out. The vast majority of people in the hospital or dying with COVID-19 are unvaccinated. I recently ordered that state government cabinet agencies require state employees to verify that they've been vaccinated. For those who don't, we're requiring weekly testing and masks. I urged the private sector to join us in requiring vaccines, and I'm proud that many local and national businesses have done just that. Businesses like Tyson Foods are requiring employee vaccinations, and many restaurants and other businesses are requiring them for customers. I think that's good. Today we have Janine Benson from Live Nation Entertainment with us. Live Nation puts on concerts and events across the country, including several major venues right here in North Carolina. They're requiring all of their employees to be vaccinated, and they're taking steps to make sure that concert goers are too. This policy will encourage more people to get their shots. And by doing their part to end this pandemic and creating a safe environment for their customers at the same time, they're helping to keep our economy thriving. I'd like to ask Ms. Benson to share a few words about why Live Nation has implemented this policy. Janine?
Thank you, Governor Cooper, for inviting me here today. Live Nation is committed to finding the best ways for shows to continue and to bring live music back to North Carolina. After almost 2 years apart, it's been truly amazing to see the community reunite as they get to enjoy live music and gathering together again. Bringing concerts back has also given us the opportunity to get a ton of people back to work. We're working to ensure that we are continuing to do the shows in the best way for staff, artists, crew members, fans, and our community. As the leader in Live Nation is implementing a proof of full vaccination or proof of negative test in all of our venues beginning October 4th. We've tried this model at a variety of events, including Lollapalooza, where we saw 90% of fans bring their proof of vaccination and 12% of fans said it was a reason to get vaccinated. Locally, we just did a show at Coastal Credit Union Music Park with the Dead & Company. We saw 70% of fans provide proof of vaccination. It's been great to see that this model has encouraged people to go out and get vaccinated, which is one of the best things we can all do to take care of one another. Thanks to Governor Cooper and Mandy Cohen and the rest of our local and state leaders for supporting our industry through this. We're really looking forward to continuing to bring the magic of live music to North Carolina.
Thanks a lot, Janine. Thank you for showing the type of corporate and business leadership that we need to end this pandemic once and for all. As most of our K through 12 schools prepare to open their doors next week for fall semester, We've seen many North Carolina school districts step up to require masks and other safety protocols for their students and staff. This includes several who've reversed course in recent days and are now requiring masks. I continue to strongly urge all school leaders to make masks mandatory for students, staff, and visitors. Requiring masks in schools will help us keep students learning in the classroom while helping to keep COVID-19 out. We want schools to educate children, not become hotspots for the virus. And I commend the school leaders who are looking out for the health of their students and their staff. I'd now like to ask Dr. Mandy Cohen, our Secretary of the North Carolina Department of Health and Human Services, to share an update on our latest North Carolina numbers. Dr. Cohen.
Thank you, Governor, and congratulations, Lily and Breland. Thank you for sharing your stories and encouraging young people to get vaccinated now. And thank you to Live Nation. I hope employers across the state will follow your lead so we can end this pandemic for good. With our trends moving in the wrong direction, we need everyone coming together to help people get vaccinated. Let's take a look at our latest data. This first graph looks at people who come to the emergency department with COVID-like symptoms. This is our earliest detection mechanism, and you can see when looking at that yellow line, it's been rising rapidly over the month of July and is now much higher than where we were last summer. Next, we look at new COVID cases. This first graph shows you the trajectory of new cases each day since we had our first case in March of 2020. The large peak you see happened early in January before vaccines were widely available. Now look to the right side of the graph and look how steep that line is. We are experiencing the fastest acceleration in cases since the pandemic started. If cases keep increasing at the current rate, we will pass that January peak in a matter of weeks. Now let's zoom in and look at just the last few weeks of cases. On this graph, we're looking at cases from the middle of June through today. And you can see, following that yellow line, that our cases have increased rapidly, and we are now averaging about 5,000 new COVID cases each and every day. This rapid increase is because of the Delta variant of the COVID-19, which spreads more easily than the original virus, leaving unvaccinated people very vulnerable. Our case rates are highest for those 18 through 24 years of age, followed by people ages 24 through 49. These age groups also have lower vaccination rates, which I'll show you in a later slide. Next, we look at the percent of tests that are positive. This graph also goes back to the middle of June, and looking at the yellow line, you can see our percent of positive tests has been above 10% throughout August, and today is at 13%, which is much higher than our goal of being under 5%. With the more contagious Delta variant rapidly spreading, anyone who has symptoms of COVID or has been exposed to COVID should get tested as soon as possible. And remember, we have a treatment for COVID that must be given within 10 days of your first COVID symptom, which makes timely identification that you have COVID even more important. While vaccinations are by far the best protection from COVID-related hospitalizations and death, as well as complications from the virus, the treatment, which is a monoclonal antibody therapy, may reduce the risk of hospitalization and severity of symptoms. But again, the treatment must be given within 10 days of your first COVID symptoms. You can find out more information on about this treatment on our COVID-19 website. On our next graph, we look at day-over-day hospitalizations. This graph also starts in mid-June, and you can see, looking at the yellow line, that this trend has also increased rapidly. Today, we have nearly 3,000 people in the hospital for COVID and 725 people in the intensive care unit with COVID. Last week, North Carolina experienced the largest single-day jump in ICU admissions since the beginning of the pandemic. This trend is alarming. Our hospitals are strained and many have limited capacity already. Hospitals are managing now by proactively scaling back non-urgent procedures and working with one another to transfer patients so that people get the care they need. But this is exactly the situation we've been working to avoid. It is imperative that everyone get vaccinated and wear a mask so hospital beds are there for anyone who needs one, whether it's someone experiencing a heart attack or a car accident victim or someone with COVID-19. This next slide looks at what's happening at the local level, and this is a map from the CDC that shows the level of community transmission in North Carolina. Red is high, orange is substantial, yellow is moderate, blue is low, and unfortunately you'll see all of North Carolina counties are red with the highest levels of viral transmission. That means everyone in North Carolina should be following the CDC guidance and wearing a mask in indoor public spaces until more people are vaccinated and viral transmissions decrease to at least moderate or low levels. All schools should require masks to keep everyone in school for in-person learning. Last week, Governor Cooper, State Health Director Dr. Betsy Tilson, and I sent a letter to local school boards urging them to fully implement the health protections in North Carolina's Strong Schools NC Toolkit to protect students and staff this new school year. I'm pleased to see that many have rethought masking and are now requiring face coverings. We need all to do so. As we move to look at our vaccinations, there is good news. North Carolina providers have now administered more than 10 million doses of COVID-19 vaccines, and more people have been getting vaccinated over the past few weeks. Our trends would look significantly worse if we didn't have as many people vaccinated as we do now. Today, 56% of North Carolinians ages 12 and older are fully vaccinated, 59% of those 18 and older are fully vaccinated, and 85% of those 65 and older are fully vaccinated. Our last slide today is a new one. It shows the percent of the population fully vaccinated by age groups. As I said earlier, our case rates are highest for those 18 to 24, and as you can see that only 37% of that age group are fully vaccinated. I also noted that we also saw an all-time high for new admissions for children under the age of 18. Only 30% of our young people ages 12 to 17 are vaccinated. Anyone under 12 doesn't have the option right now to get vaccinated. They're relying on us to protect them by getting ourselves vaccinated and wearing masks. If you haven't gotten vaccinated yet, I urge you to do so now to protect yourself, your community, and those who cannot be vaccinated. In North Carolina, recent data shows that unvaccinated people are more than 4 times, that's 400% more likely to get COVID-19 than people who are fully vaccinated. New CDC data today reaffirms that vaccines continue to be remarkably effective in reducing the risk of severe disease, hospitalization, and death, even against the widely circulating Delta variant. Nearly all the cases of severe disease, hospitalization, and death continue to occur amongst those who are not yet vaccinated at all. We see this in North Carolina, where our hospital leaders continue to share that almost everyone in the ICU, the intensive care unit, and on a ventilator is unvaccinated. Bottom line is that vaccines save lives. There's new CDC guidance for people who are moderate to severely immunocompromised. The CDC recommends that if you are immunocompromised and you received either the Moderna or the Pfizer vaccine, that you get an additional dose for better protection from COVID-19. Emerging data suggests that some people with moderate to severely compromised immune systems do not always build the same level of immunity after vaccination compared with people who are not immunocompromised. So in addition, to continue to protect against severe illness, hospitalization, and death from COVID-19, as we head into the winter, the White House today announced that it's planning to support booster shots for the general population. Boosters will be available after September 20th, pending full review by the FDA and CDC. Once authorized, people who receive the Pfizer or Moderna vaccines will be eligible for a booster starting 8 months after their second dose. So we're at a critical point in the trajectory of this pandemic. We have high levels of a highly contagious COVID virus circulating in our state, and hospital capacity is already strained. But we have the tools to save lives, and ensure our hospitals can provide care to those who need it. To weather this storm, vax up, mask up, and urge others to do the same. If you're already vaccinated, talk with your unvaccinated family and friends. Share your experience. Help them get accurate information and urge them to get their shot now. It could save their lives. Thank you, Governor.
Thanks, Dr. Cohen. This is not where we want to be, but we have a sure way out: vaccines. Last year, we wondered when this would end and how we could best protect ourselves. The difference now is that we have the most powerful tool against this virus: a safe, effective vaccine. We're putting all of our energy and laser focus on the vaccination effort. I've asked the President to authorize more National Guard help so we can get vaccines to communities across the state. Vaccines are available everywhere: schools, gyms, communities centers, doctor's offices, pharmacies, health departments. Volunteers are even reaching out to people one-on-one, offering information and rides. It's encouraging that our state's vaccine rate has increased in recent weeks. We need to double down on that progress. Talk with your friends and family about why it's important for all of us to get our shots to protect each other. If you're an employer, join businesses like Live Nation and require your employees and customers to be vaccinated or tested regularly. If you haven't gotten vaccinated, make time to get your shot and talk with your doctor today. And throughout it all, never lose sight of our North Carolina resilient spirit. We can beat COVID for good.